PainCare, built on the next-gen engine, is brought to you by ITelagen. PainCare is a complete solution that's designed to be simple and easy to use, and to enhance your clinical, business, and financial performance. And it's affordable for all size practices. This video will provide you with an overview of the main features of the PainCare suite. Keep in mind that the system is fully configurable with no template modifications, so the order of the sections covered in this video can be adjusted to fit your practice's workflow. Let's start by looking at the dynamic HPI template. All chief complaints packaged with the PainCare suite have been configured to use this template for documenting the HPI. Once you select a chief complaint, the dynamic HPI template opens and you can start documenting the HPI. Simply click on the section you want to document on the left-hand side and select the appropriate response from the right-hand side. As you make your selections, the template will automatically generate a paragraph based on your choices. Selecting certain options such as a symptom of pain will result in additional sections appearing to use for documentation. The sections that have been configured specifically for the PainCare suite include number of episodes per day, primary pain location, additional pain locations, patient denies pain, patient ratings for best, worst, current, usual, at rest, and with activity, pain radiation, associated symptoms, previous diagnostics, medications, injections, treatments, surgeries, and their outcomes, as well as sleep pattern and work status. The PainCare suite makes it easy to duplicate an HPI from a previous visit using the copy forward function. Once you select the HPI you want to copy, the data will be carried forward and you'll have the option to make any necessary changes. If the chief complaint you want to add is not available in the PainCare suite, you can add a custom chief complaint in the Other box in the Reason for Visit panel. If you use a chief complaint frequently, it can easily be added to the dynamic HPI template using the dynamic HPI config practice template. Next, let's look at the screening tools. They're easily accessible using the left-hand navigation bar or the sub-navigation bar at the top. The screening tools template includes the CAGE questionnaire, generalized anxiety disorder GAD-7, patient health questionnaires PHQ-2, PHQ-4, and PHQ-9, the drug abuse screening tool, opioid risk tool, and the Oswestry low back pain questionnaire. As an example, let's look at how to document the score for the Oswestry questionnaire. Simply choose the appropriate responses in each section to automatically calculate the score, which will be saved in the Screening Tools template. The score is then available using the Screening Tools links anywhere in the system. The Intake template also allows you to document urine screen results directly from a urine screen order. Entering the urine screen results will automatically generate results details into the order once it's been completed. In the Histories tab, you'll find the Persistent Pain and Procedure History panel. This panel allows for quick viewing, adding to, or editing a patient's pain and procedure history. To add information to the grid, select the appropriate checkboxes in the Persistent Pain and Major Medical Procedures panels, and if applicable, select a side or onset date. When you're finished, clicking Add to Grid saves your entries in the Pain Procedure History grid. The selection of options in these lists is fully configurable for your practice and can be modified to meet your practice's needs. It's also easy to remove or edit existing entries after you've made them. When editing an entry, you can document things like the facility, provider, outcome, and add comments. Now let's move to the SOAP template's physical exam panel. The physical exam panel has been configured with quick links to commonly used physical exam templates, such as the one-page exam, range of motion, and cervical, thoracic, and lumbar spine exam templates. The PainCare suite conveniently allows you to copy forward an entire physical exam from any previous encounter using the copy forward function. Simply select the encounter with the desired date, rendering provider, and visit type. The previously documented physical exam will display in the grid so that it can be reviewed to ensure the correct exam is being copied. Clicking Copy Forward will display the physical exam in the grid. The correct scoring for the physical exam will also be calculated in the Evaluation and Management Coding panel on the finalized template. There are also two common assessment templates in the PainCare suite, one for diagnoses for the spine and one for diagnoses for extremities. These templates allow you to add commonly used assessments with a single click. To make it easy to efficiently document a patient's plan, the PainCare suite includes a list of commonly used phrases. Selecting an item will automatically enter it into the grid. In addition to the common phrases, the PainCare suite has been configured with a list of common patient education items that can be quickly added to the patient's plan. A list of available patient education orders can be configured by practice, location, and provider. Each available order can be linked to internal and external education resources as well. Note that selecting education items from this list will create orders that display on the checkout template and give the provider credit for the patient education meaningful use measure. The PainCare suite also makes it easy to record commonly used procedures, including Botox injections, epidural steroid injections, joint aspiration or injections, lumbar punctures, and nerve blocks. Each of these procedure templates allows the provider to save default selections, making it easy to document common procedures. Now we'll take a look at how you can document pump procedures with the Pump Refill Reprogram template. The template includes pump details documentation, intervention and adverse event history, Pump Refill Reprogram, which includes automatic calculation of dosing, dosing changes, and medical billing units, patient therapy manager documentation, and bolus documentation. The information entered here will be used to calculate pump visit codes in the Finalize tab at the end of the visit. Risk factors in the PainCare suite have been configured to include the following additional risk factors: depression, blood thinners, and pregnancy for female patients. The PainCare suite also allows documenting the following information from the risk factors: blood pressure counseling, blood sugar readings and control methods, blood thinner details and INR results, patient health questionnaires PHQ-2 and PHQ-9, and LMP and pregnancy due dates for female patients. The ability to copy forward an entire review of systems from any previous encounter has been added to the PainCare suite. To copy forward a review of systems from a previous encounter, click the Copy Forward button in the Review of Systems panel on the SOAP or Intake template. A list of encounters that are available to copy is displayed. Select the encounter with the desired date, rendering provider, and visit type, and click the OK button. The previously documented review of systems will display in the grid so that it can be reviewed to ensure the correct one is being copied. The review of systems will be copied forward and display in the grid. Note that the correct scoring for the review of systems will also be calculated in the Evaluation and Management Coding panel on the Finalize template. The PainCare suite allows a user to quickly view the following types of medications by filtering the medications grid in the Medications panel on the Intake and SOAP templates: opioids, non-steroidal anti-inflammatory drugs, and antagonists. A user can check the Include Inactive checkbox to view inactive medications as well. PainCare is your solution for working seamlessly, efficiently, and effectively in pain management practices. To learn more about PainCare Suite, speak with a product specialist, or get pricing information, call us today at 833-PAIN-EHR or email sales@paincareehr.com.